What were the outcomes of a phase 1 study looking at Ublituximab, which is a novel CD20 antibody, in combination with Umbralisib, which is a PI3 kinase delta inhibitor, and Ibrutinib, which is a BTK inhibitor in relapsed refractory CLL and a cohort of non-Hodgkin lymphoma patients. So this was a publication that we were quite proud of because it was a phase 1 dose escalation study across multiple centers. It was open label prospective study, but there were also 2 separate cohorts, NHL and CLL, with expansions in those areas. And the novelty behind this is potentially adding multiple targeted agents. You may be able to overcome resistance mechanisms of targeting just one enzyme in the B-cell receptor signaling pathway. And particularly in mantle cell and CLL, when patients start to fail agents like Ibrutinib, outcomes can be quite poor. So that was the rationale behind this combination. It was a phase 1 study where safety was the primary goal of this trial, so looking at the incidence of treatment emergent AEs, dose-limiting toxicities, and a standard 3+3 study design was the goal of the trial. What was quite striking is that there was no additive toxicity, so despite having multiple targeted agents that may have some overlap in terms of targets, we didn't see additional toxicities such as increased infection rates, increase in pneumonitis, colitis, etc. So that was quite striking. I think particularly when you start targeting the PI3 kinase pathway, toxicities tend to emerge as a common discussion point, and so that was quite encouraging to me that we didn't see additive toxicities. And then lastly, the efficacy looked quite good, even considering it was a phase 1 study with patients who had failed multiple prior lines of therapy, including a small portion of patients who had failed prior BTK or PI3 kinase targeted therapy, suggesting that this may actually help overcome resistance mechanisms.